Mm, that's good coffee. I missed that spot. Good morning. My name is Thomas Kaufman, and I am the host of The Athlete Unfiltered. Welcome back to another episode. And in this episode, we're going to be talking about low back pain in strength athletes. Now, this episode, we are not going to be talking about sharp shooting pain going down the leg or up the spine. We're going to be talking about and focusing on pain that is there. It's pretty local, it stays there, but it's annoying, it's deep. You just want to get rid of it because it's a nuance in your life. So, that's the type of pain that we're talking about. We're not talking about the one that is radiating down your leg and it's not allowing your foot to work properly, or it's debilitating to the extent that you have to be in bed for 2 to 3 days. That's not the pain we're talking about. We'll talk about that pain in a different time. So, when we're talking about this type of low back pain, right? Um, it's not debilitating, but it's something that we want to get rid of, right? And there are pains that we want to get rid of, and it's totally fine if you want to get rid of some pain. Like that's normal and it's natural. The first thing that we got to understand is some pain is okay because you're a human. You're going to experience pain. So understanding that if you experience pain, you're alive and you're healthy. Good. Now we can treat what's causing the pain. And when we talk about this type of low back pain, I don't believe there's a name for it, but it's usually something that people can live with. Now, they don't want to live with it, so we try to do our best at fixing it. And through the last 6 years, working with athletes in all populations, youth, collegiate, semi professional, professional, recreational, blue collar, all of that, there's a couple of things that have popped out or that keep coming as major themes when we're looking at back pain. And we're going to be talking about the top three today. The first one is biomechanics. So for the most part, correcting somebody's technique, while it may have not been the cause of the pain, has seemed to improve a lot of patients' pain. Not only has it made it better, but it also allowed them to get stronger, work out longer, participate in activities outside of this or within their social circles throughout the weekend and the week with less back pain. So we tend to put a little bit of emphasis about how they move, how often they're moving, and what are some movements that they want to incorporate the most in their activities of daily living, and movements that they may want to get rid of completely, right? But this is always based on personal preference as well as personal lifestyles. The other theme is load and overuse. How often you're loading it, how much are you loading it? Are you loading it too much, too little, too much, too often, too little, too often? Are you going too quick, too fast, etc.? And finally, some of the implements that they're using that may actually causing the back pain, and some of them that may actually help them. I'll say, for example, we just had a patient probably about 6 months ago. They came in and they had back pain. And originally, it had started from doing lunges. They messed up lunge, caught themselves, muscles tweaked, and they had back pain for a couple of days. It was getting better, and then they were introduced to a Theragun, and they did the Theragun, and it got slightly better. So they thought that instead of doing it for 5 minutes, they would do it for 20 minutes. Well, when they came to see us, they were doing the Theragun for 20 minutes a day, every single day, continuously. And the back pain would get better, but it would get worse towards the end of the day. And one of the discussion points of our conversation back then was, what if you stop doing the Theragun? Almost shocked him that I said that, but we tried it. 2 days, no Theragun. Back pain improved almost 80% in 2 days. So, yes, there are things and there are tools and implements out there that are meant to help you recover. But if you do it too much, just like exercising, you can actually get some negative side effects from it. So, we'll talk about that a little bit more as we get on. So, let's go ahead and talk about back pain. Now, we're not going to be talking about what causes back pain. That is a very in-depth topic, and that's one of the topics that we're going to leave for one of our longer sessions. But we're going to be talking about some of the corrections that we usually end up doing here at the office that typically help majority of patients, 90%, to get out of pain, get back to doing the things that they want to do, and from there on, we just build. The first one is bracing. Now, bracing is different from just sucking in your belly or going to work out and doing 1,000 crunches or doing vacuums or doing side planks or whatever it may be. Bracing is a different type of load in the abdominal cavity. And we're talking about the abdominal cavity, or I say abdominal cavity, you know it as the core. Now, the core is not just the abdominal muscles that you can see in front of you. The core is the abdominal muscles that you can see in front of you, the ones on the side, and the ones in your back. So the core itself is not just one or two muscles, it's about nine of them. And if we break it down into all the smaller muscles that are in the spine, we get to more than 10. So there are a ton of muscles working here to maintain core stability. And when we're talking about core stability, is not how well you can just stay midline under a load, but how well your core is going to react to any outside stressors. If somebody comes and pushes you off, are you just going to flop all over like one of those air thingies outside of most uh, used car lots, right? Um, that's what we're talking about core stability in that sense today, right? We can change, no, we can't, but whatever. Anyway, back to mechanics. So the first thing that we want to do is know if they are able to produce a proper brace. And typically is take a deep breath in, and you will see them, and you will see their chest rise. Now, at that point, we know that they're not breathing deep into their abdominal region, creating what we call intra-abdominal pressure. Now, intra-abdominal pressure loads the abdominal muscles from the inside out rather than you focusing on contracting them from the outside in. So, when we're looking at bracing, we have our athletes and our patients take a deep breath in. If they breathe into their chest, we tell them hold that breath and try to push it down into your belly button. And they do that, right? And now they are feeling what we consider proper bracing. Now, granted, there's a little bit more that goes into it, right? So having a good 360-degree brace means that you have good abdominal pressure in the front, but also you're able to contract the muscles of the back and the sides. And you're actually contracting them outwards, not inwards. So a lot of athletes and a lot of patients have been taught that they have to suck in and have a skinny waist in order to utilize those muscles. We are going to challenge that, but if we were to challenge it today, we would actually have a much longer podcast. And that's not the goal. So, bracing is the first thing that we take a look at. Once we see that they're able to brace properly, then we're going to start loading them, whether it's their squat or whether it's their deadlift or whether it's their bench. And we're going to take one of those exercises and we're just going to load them slightly, just enough that it's good effort, but they're able to maintain their brace. Now, if we change their brace or we improve their bracing ability and back pain subsides and it gets better, that's a plus. If we improve their brace and we're able to load them and their back pain is not present, that is also a plus. So we are moving in a positive direction. Now, when it comes to mechanics in lifting, there are your general mechanics. Take, for example, squatting, right? Most coaches, personal trainers, physical therapists, and chiropractors who know a little bit about squatting, they're going to have you put your feet toes straight forward, feet shoulder width apart, and they're going to have you sit down in your heels, right? Now, that may not be the squat for you, but it is the general approach on how to teach a squat. And this is where we come in and we figure out the squat pattern that is most apt for you, that still loads the body evenly from left to right. Okay. So those are the type of mechanical changes that we start doing and we start promoting in our office. Now, we don't promote it because it's the right way or the only way, but we promote it because it's the way that you are showing a positive result. Now, could we also do dry needling? Could we do some cupping? Could we do other kind of therapies and reduce the pain? Sure. But those are not going to last as long as you learning how to move properly and overcoming pain by moving properly. So when we put it all together in a treatment plan, yes, we utilize some manual therapies here that help you reduce the pain. Then we load you. You learn how to move with less pain. And we hope that this creates a positive reinforcement for you to do these things home at all the time, right? So those are parts of what we look into the mechanics, right? So bracing, how they move, and if they are moving and bracing in a different manner with less pain, then we just simply start building from there. Now, we could at some point, based on the skill, the requirements, and the needs of the athletes, we may have to go back to how they're squatting. If they are powerlifters and they have to squat in a sumo stance because they're trying to move the most amount of weight, we're going to have to look at powerlifters slightly different than if we were working with the general football athlete or the weightlifter, especially if they're having similar back pain on their squat. So we will have to come back to different mechanics at some point, but it's important to start with mechanics that reduce the pain and continuously help athletes move. Number two, load and overuse. Um, Most often, I want to say, I don't have specific numbers, but most often I would say most of the athletes that came in with back pain came in after a very, very heavy day, and it's usually close to their 85 to 90% max of a lift, whether that be squat, bench, deadlift, whether that be just running. We've had athletes with low back pain that ran like 8 miles today or yesterday, and all of a sudden like they're in excruciating pain. So here is where load and overload and recovery are going to come in handy. If we look at your program and we continuously see that you're pushing heavy numbers and heavy numbers and heavy numbers and heavy numbers, and you have tons of exercises lined up, after your heavy numbers, and you're loading the tissues and you're loading the muscles and you're loading the system, and we don't see a break, you just keep going on up, 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 which we call linear periodization. If you keep going up and never allowing your system to recover, you are building a recipe for disaster. Now, your recipe for disaster might take 3 months. Somebody else's recipe for disaster might take 6 months. Somebody else's might take a full year. It's okay, right? Everybody's different. But if you are the person that was a 3 month recipe, you need to learn how to or when to take a step back and reduce the load and reduce the volume and recover properly. Now, recovery doesn't mean just go lay down and be a vegetable for a full day. It just means that hey, you may want to do different activities today. If you're a power lifter, you may want to just get on the treadmill, walk a little bit. or go for a walk or go for a hike. If you are a CrossFitter, this means that you may want to do a little bit of yoga. You may want to go get a massage. You may want to stretch a little bit more often. Now, there's nothing wrong with training for strength and stretching and doing cardiovascular activities. Actually, you should do them all at the same time. Not at the same time, but you know, within a good program. But here is where loading tissues and overloading them comes into play. Now, very few instances are athletes still under a coach who is deliberately and diligently looking at how much load they're going through day in and day out. Not only does the load of exercises matter and practices, but it also matters because every single individual is going to handle stress slightly different on a day to day basis. You may have two similar athletes, two football players that are going to the same practice, that are doing the same lifts of the same strength, but outside of practice and training, they have separate, completely different lifestyles. One has to work 2 to 3 different jobs, and the other one is lucky enough to only have to work one or work hard enough. I don't want to say lucky enough, right? Work different and was able to get a job where he only has to work one. Those are different stressors. And they may not have the same sleep patterns, right? The one that works 3 jobs may only be able to get 4 to 5 hours of sleep a night. The one that only works one job might be able to get 8 to 9 hours of sleep at night. So they are going to be recovering differently regardless of how similar their training is. So one is going to be more at risk of an overload or an overuse injury versus the other one. And this is where you cannot, as an athlete, if you don't have a coach that is looking at your load, your repetitions, your volume, and it's guiding you through this, you cannot just go ahead and be like, well, John over there is doing the same weight I am. We do the same thing. And he's married, I'm married. I should be able to do the same thing he does. That's not the case because John may have a coach and the coach may be telling him to go heavier and then go lighter in other exercises and take it easier. What you're probably going to do is you're going to go heavy on your squat, and then you're going to go heavy on your lunges, and then you're going to go heavy on the leg press and heavy on the leg extension machine and heavy in another exercise, and then you're going to finish it with sprints. And you're going to say, yeah, I beat John. But John is smarter because he's going to train longer. You're most likely going to burn out, which is a different topic, right? But when we look at load and overuse, that's where we ask our athletes and our patients to say, hey, let's take a look at your training plan. Let's take a look at your training program. And we assess it. And if they are working with a coach, we may reach out to the coach and just have them explain to us what's going on with this athlete. Where are the recovery periods? How's their nutrition, etc. So those are the top two reasons why we've seen some people with back pain. And that's usually how we start, right? So we start with mechanics, then we start with the load and overload issue. And then finally, we look at implementations implements and tools, right? We've had a couple of athletes come in, mostly cyclists that lift, right? And they complain of low back pain in a flex position. They don't complain about low back pain when they're on their bike, which is also a flex position, but they complain about their squat and their leg press and all that stuff. And we've already talked about the individuals with the Theragun, right? But now we're going to be talking about individuals that don't know how to use a belt, a lifting belt for that part. And this is where asking for help as an athlete, learning how to use these implements and tools that are available at any gym is going to help you. Yes, when you get started, when you grab a belt for the first time and you squeeze it around your around your belly, and you can't even take a deep breath in because you're about to explode. Yeah, it feels pretty cool, right? You're now able to put 25 more pounds on each side of the bar or on the leg press, and that weight is going to move because you just increase the exponential capacity of your body by, creating fake intra-abdominal pressure and just helping yourself there. Now, is that sustainable? Not in the long run. And the more you do it, the less likely you are to continuously push as heavyweight, right? Now, we've had a couple of cyclists that come in, start lifting weights, use the belt, and they do that same thing, right? They tighten it so much around their waist, they're barely able to take a deep breath in, they're barely able to move around without it. But they don't take it off in between sets. They just start their set, and as long as they're doing that exercise and they're going to be using the belt, they keep it on. And again, a very simple solution here. Why don't you loosen the belt one or two buckles? Or why don't you take the belt off while you're not under load, while you are taking a break? In both scenarios, we've seen positive results, right? We've seen less discomfort, less pain following the workout. So this is where tools and implements can be hindering an individual, right? If you're not familiar with belts, there's different belts for weightlifters, there's different belts for powerlifters, there's different belts for just resistance training. There's belts that are thin, there's belts that are thick, there's belts that are super wide, there's belts that are kind of skinny, there's belts that are like in between, skinny in the front, thick in the back. And they all are going to serve a different purpose, and they're all going to fit slightly different. So here is where you can't just take somebody else's belt or use a general belt and just apply it to your training, to your own body type, etc. We can talk about that in a different episode. Now, could belts be beneficial? Absolutely, right? We've had athletes that we recommend using a belt at, moderate loads so that they get the feedback that we want. And we use the belt as a feedback tool. We don't use it to squeeze the gut. We don't use it to hold anything in. We use it to provide a stimulus to the system so that they can brace. We're going back to the brace so that they can brace better, especially under loads that require light flexion and extension of the back. We're talking mostly about squatting, deadlifting, power cleaning, snatching, right? Yes, there are other individuals like bodybuilders who they use it for different reasons. We're not going to get into those. But can belts be helpful when you're having back pain? Absolutely, right? They can be very helpful, but if you don't use them right, they can also hinder by causing some discomfort and back pain itself. Now, when it comes to other tools like the Theragun, scraping, dry needling, right? Uh, Chiropractic, massage, supplementation, they're all going to work in different ways for every different person. Now, we're a chiropractic office, and we focus on sports medicine and preventative care for for athletes, right? But we use the adjustment. We use manual therapies. We use saludo scraping. We use dry needling. We use cupping. We use e-stim. We use exercise as a treatment tool. But not everybody gets the same treatment tool all the time. And some of them may outgrow a modality or they may outgrow a treatment, right? We may start somebody by adjusting them, and then all of a sudden, 2 to 3 sessions later, you don't need an adjustment anymore. We just need to focus on mobilizing them, making sure that their joints are mobile. And we can do that with movement, exercises, loads. But hey, maybe 7 sessions later or 7 months later, we usually hold people for too many sessions, but maybe 7 months later, they're out, they tweak their back, they come back in, and hey, all they need is an adjustment, or all they need is a dry needling session, or all they need is some soft tissue session. Maybe that's all they need once, and that's perfectly fine, right? It can help. Now, everything comes with a risk. The adjustment. What's the risk of the adjustment? Well, you can get a little sore, right? It could aggravate some disc issues on certain people, not everybody, right? What is the risk of getting scraped? Well, not much other than a little soreness, but if people continuously overdo it, then you look like those individuals that if you look at Graston technique on a back and it looks like somebody took a trailer and ran over them, that's too much, right? Um, Not probably needed to that extent. So, yeah, there are side effects and there are risks, right? So, when it comes to tools and implements, we take an approach on what is going to be most beneficial for the athlete. And you may not have the answer as an athlete of what is going to be more beneficial for you, right? That usually only comes out when you go and visit a clinician and the clinician starts talking about some treatment options and you start thinking about what you feel and both of you working together put your treatment plan together. Now, if all you've been doing is strength training and loading and you have back pain, chances are that what you don't need is more loading. It may just be better bracing, better mechanics, better loads, better recovery, or you may need some tools and implementations that are going to help you overcome that and get back to training. Now, so now we are past our 15-minute mark today. I apologize. Today's been a good one. So, what did we talk about today? Today we talked about low back pain in strength athletes. We covered mechanics. We didn't really cover biomechanics of what goes wrong, but we talked about what we start changing, and we said bracing and bracing under load, and then we said the biomechanics. We fixed the biomechanics to meet the athlete's needs. Now, load and overuse is typically one of the things that comes out often as well. All right. Whether a person is doing too much, too often, all the time, which is usually what happens. And then we see the opposite of it too. They don't do a lot at all, most of the time, all the time. And then they want to do a lot, right? So too much, too quick. And then we look at the recovery. And then finally, we talk about some tools that you may find at the gym, like the belt, some tools that you may be able to purchase, like a Theragun, and then some tools that may be available to you through your clinician, adjustments, soft tissue therapies, dry needling, acupuncture. Um, all of that can help you, but all of that can also hinder you. But it's always going to be a conversation that you can have with your clinician and your coach, right? If you don't know how to use an implement, or if you have questions about implements, you can send us a message on Instagram. There's our tag at @the_athlete spot. So send us a message. If you have any questions, we typically respond to all of these questions on Tuesday. And that's it for today. I hope you guys have a great day and have a great weekend. We'll see you guys next week.